So I thought it was important just to show you a brief way we do the reimplantation operation. So here we are putting the pleated sutures for the commissures into place, and that's going to be anchored in the tube graft. And here we're just freeing up the valve, and it's very important that the entire valve is freed up. And then once that is done, we then put sutures underneath the annulus through the left ventricular outflow tract, and these are going to be passed through the new tube graft to anchor the valve inside the tube graft. It's critical that the entire valve is within the tube graft. In the right ventricular outflow tract area, this can be a bit more tricky because the annulus typically is lower than the right ventricular outflow tract. And so it takes time to make sure that this is very carefully done and the sutures, in a sense, threaded in the aortic wall so that one doesn't tear the right ventricular outflow tract. So once those sutures are in place, then the tube graft is taken and put down to surround the valve, and then I use a hay gauze dependent on the body surface area of the patient to make sure that one doesn't make it too tight and to not cause stenosis of the valve. Then once those sutures are tied down, then those original anchoring commissure sutures are then marked in position to make the valve competent, and then the valve is sewn into position into the tube graft. And I try and make a bit of a new sinotubular ridge for the new valve. I think that probably is important from a hemodynamic point of view. So this is then just sewn into position and the valve is anchored in position. So one ends up with two suture lines here, the one at the edge of the valve and at basically right next to the annulus, and then there's the suture line in the left ventricular outflow tract below the aortic valve annulus. And there's the non-coronary sinus being sewn into position, and it's important that one doesn't tear the leaflet and one doesn't capture the actual annulus when one's doing, because then that can tether the valve such that it doesn't function freely. Then the buttons are made for the coronary arteries. So first the openings are made in the Dacron tube graft, and then those buttons are sewn to the tube graft with a Teflon donut around the buttons, and obviously in this patient with Loeys-Dietz, but I use this routinely for all patients, it's important that that is done so that you don't get an aneurysm later on down the road at the coronary buttons. And having done many hundreds of these, I've been fortunate so far not having to reoperate on anybody because they've developed an aneurysm at the buttons, although we certainly see that. And here's the right coronary artery about to be reimplanted. It's absolutely critical that the coronary sinus artery that comes off either from the right coronary artery itself proximally or from a separate ostium is reimplanted, otherwise arrhythmias can result. And there's just testing the aortic root and making sure there's good hemostasis, and then the distal anastomosis is done to the distal aorta. In this case, the aorta is pretty normal, and so this anastomosis is done just proximal to the innominate artery. Then we check for hemostasis, and usually there's not a problem with hemostasis. The patient is defibrillated and then weaned from cardiopulmonary bypass. So there's just a brief video of how the reimplantation operation is done. Thank you for your attention.